Tēnā tātou, i raro te whare, i tēnei wā, e te matua e pēn, tēnā koe e oku rangatira, oku whānau, oku iwi, kua hui mai nei, tēnā koutou, tēnā tātou katoa. Thank you very much, Gilbert, for that warm welcome. I guess a week on the job, I was charged with all sorts of things to do. 2 weeks on the job, this particular hui came up and an invitation was extended. So I've got some notes just to make sure I'm in the right place, because it's been a little while just to acclimatise. 2 weeks is not quite enough, so I thought I'd better bring some notes just to help me through this very, very important occasion. So thank you very much, Gilbert, for the privilege of just offering a few opening remarks for our hui this morning and this afternoon, should I say. It's my privilege just to warmly welcome and to endorse the words already from our kaumātua, Ben and others, Calvin as well, to this very, very important gathering. I'm pleased, I guess, from the Rūnanga's perspective and also from Te Hauora o Ngāpuhi and the Drug Foundation to be able to be working together and to bring such a diverse group of people here for this important hui and this important discussion along the lines of the kaupapa that's been kind of laid out for us this morning. The Rūnanga's vision and mission are built upon the unique characteristics and beliefs and values and stories that make our people proud to be Ngāpuhi. However, like a lot of socio-economic indicators, for our Ngāpuhi people, for Māori in general, they're all really at the wrong end of the scale, aren't they? They're all far too high. And so it's critical that we not only consider the range of issues with current drug laws, but also understand the deeper reasons why drug use is so high, particularly in Northland, particularly in this place. But more importantly, we must think about what we can do as individuals, as whānau, as hapu, to effectively and appropriately address the root causes. Because for many of us, it's personal. And I guess with a lot of us that are sitting out here today, we can attest to all sorts of stories and things in our own whānau, in our own situations that have impacted us. And at the core of it all, I believe, is really where it all resides, is the issue to do with poverty, a sense of hopelessness, a sense of separation. It also may include, I believe, a greater focus on preventing and treating problematic drug use and its effects, and redirecting resources from punitive type enforcement to kaupapa Māori, health and socio-based approaches. So consideration with respect to appropriate and effective proportionality of resources will also be important. So both it's personal, so it really does motivate us to do something about it, but proportionately where the resources are going to, it's really equally important that that be talked about and addressed as soon as possible. I'm pleased today that the hui will build the momentum towards better understanding and the critical debate and discussion of how we can lead and influence a positive change needed for our communities. I welcome the new multi-million-dollar investment and facility to help reduce methamphetamine in Northland and encourage those responsible to include Ngāpuhi in those discussions and decisions. But for us in the Tai Tokerau, this is clearly an urgent priority for us. So in closing, I extend a warm thank you to everyone, including the local politicians here and the community representatives for their support, and encourage healthy discussions and debates during our hui, during the course of today. So my last thought is a thought that comes to many Māori in terms of these types of events, and it goes like this. Ko te kai o te rangatira, ko te kai o te rangatira, ko te kōrero. Nō reira, ngā raurangatira mā, tēnā koutou, tēnā tātou katoa. Kia ora, Gilbert.